Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
How to overcome cervical pinched nerve and radiculopathy. No worries. That's what you're claiming. We won't need any worries, right?
Well, yeah, people get these symptoms that we're talking about, and they can be very worrisome because you're really not sure what's going on.
Yeah, when you start getting pain and numbness and tingling all the way down the arm, that's scary.
And into the hand, yeah. So we're going to explain to you, first of all, the terms, too. Where do they come from when the doctor says you got radiculopathy? You're wondering, oh my gosh,
that's ridiculous.
Yeah, but it's really not once you understand it. So a pinched nerve, let's talk about that first.
Sure.
A pinched nerve, as far as if you're having pain, symptoms down the arm to the hand, oftentimes, excuse me, Sam.
Yeah, we got Sam the super skeleton here.
Yep. Oftentimes, the pinch is actually around the spine area. Okay, it could be down, this nerve goes in the brachial plexus and it travels down past the first rib and under the clavicle, and there's some areas in there that it could get pinched.
Yeah, it could get pinched anywhere along the pathway, really.
Right.
But the most common area probably is up in the cervical spine.
And if the diagnosis is radiculopathy, that is referring
to the neck.
To the neck, or to the spine.
If your doctor says you have a radiculopathy, yeah, it's neck.
Right. Well, that's what they think it is.
Yeah, that's what they think it is, right.
So anyways, it's important to have that cleared away so you just understand the term, what they're talking about, make you feel better at least that way. You know it's just not just a large term that's getting you nervous.
So if we have the radiculopathy, we're going to be doing things to the neck to try to take the pain out of the arm.
Right. So, precisely.
By the way, Brad, in case you are new to our channel, please take a second to
Wow.
subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go over to...
Over there.
No, over there, Facebook.
Oh, the sign, yeah.
Yeah, and make sure you like us because Brad and I, all this week, again, we're having the same sale. If you like us, some angel's going to get their wings.
Oh, yeah, that's right. Yeah. And we got to get more wings out there because, well, that's just a good thing.
It's a heavenly thing.
So, not only at this time, we're going to show you some treatments that we've shown in the past, but we're going to go one step further and show you how to actually, in a systematic way like therapists do, how to treat your neck so your success rate becomes much better.
Well, the first thing to do is document what your symptoms are, because this happens to Brad and I all the time. We document it, and then somebody will come saying, no, it's not getting any better. I go, do you still have numbness down here? Well, no, that went away. Well, do you still get pain in the hand? Well, no, that went away. So you did get better. And you have to be, you want to make sure that you're seeing that things are improving. Do you want to show that for me?
Sure. So one thing what Bob was referring to is something we call centralization.
Right.
If you've got pain and symptoms down into the arm and the hand, and they start to improve what we call distally or further down here, let's say there's no more pain below the elbow, but you still have it up here. That's a really good sign.
Yes, it is.
You're making progress.
That's what we're looking for, is the pain to travel back up and into the neck. Well, it'll eventually go away.
So what we want you to do is get a piece of paper. We're going to show you a Mckenzie form that we use, but you could just take a piece of paper and draw out a really rough sketch of a body with arms. You don't have to go down below the waist. How are we doing here, Lonnie? Can you see this? We focused in. This is my best side, by the way.
There's no best side, Brad. Sorry to tell you.
So if you have pain or numbness or tingling and it starts in the shoulder and you feel it, and I want you to be specific, if you feel it in your bicep, make sure you draw it on the front, or if it's in the tricep, you'll draw it on the side, and make sure you get it the right arm or the left arm. And then if it goes to specific fingers, it's nice to draw which fingers you feel it in, because you may not remember that a week later. Okay, so it may look like a solid blue thing all the way down, but it may be only in your pinky ring or half your ring finger and middle finger. And then you have some information of where it was.
And I would rank it, too, from 0 to 10.
Right, so you know how severe it was.
Right, 0 meaning no pain, and 10 meaning you'd have to go to the hospital. It's so bad.
And then you set that off to the side. Because you're not going to remember this information a week from now. And like we said, people forget about how bad it was. And then they say, oh, that's right. My fingers were numb, my hand, my arm, my forearm. So do that first and then set that aside. And then the very next step is check your range of motion of your neck. Okay, the first thing that usually isn't too bad, we'll ask, can you bend forward? And then we'll ask, can you do a chin tuck, which is kind of a strange move where you like bring your head like someone's going to take a pie, put it in your face, and chin tuck in. So it's not in and down, it's in and back. Okay, if you have pain with that, you'll note it. And then the location of the pain, if it feel it in the shoulder. Sometimes I'll have people do a chin tuck and say, oh, it hurts right here, where it doesn't make sense. But that does make sense when it comes to radiculopathy.
And that's when it's really verifying that it's coming from the neck.
Right.
If this any of your neck movements start changing the pain down on the arm, it is a good sign that's where it's coming from.
It's a
then.
true radiculopathy, correct. And then you're also going to check extension. If you can go all the way back like this, then that's normal. If you go back halfway and it's like, oh, this is no good.
And Brad and I are going to say very commonly that's where we find the lack of movement is going back.
Yeah. It's either going back or if you do a side bend, which you're going to go to the right. So I always tell people, bring your right ear to your right shoulder, but don't rotate your head. So
do it with good posture, Joe.
Yeah, shoulders back. And typically this is done in a chair. I'm standing now, but we'll do it in a chair, like Bob's sitting there. And you're going to check both directions. You may find one direction is normal, the other direction is not near as good, and it's painful. Make sure you write it down, side bend right or left. And then, of course, rotation, looking over your right shoulder without moving your shoulder.
Right, you don't want to be turning your body along with it, just turning it.
And sometimes that will have a significant change. And then each direction you're going to make a note, and you can do that on the same paper. You have your diagram with the pain location. And then you have that set aside. And that's another indication of a week later you'll
if things are getting better.
Right.
If it's moving better or hurting less in that direction. So, well, let's start some exercises.
Right,
then.
okay. La da 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 da. We're both getting the chair.
La-di-da-di-da.
Okay, another thing that can be really helpful if you want to take care of your radiculopathy and pain is, and you want to do it yourself and have some really good documentation and information, is the Mckenzie Treat Your Own Neck book. We do
We'll put a link down below because it's really a good book, and it'll cover everything we're saying today in better detail.
Right, yeah. He did a little better than we are explaining things. And it's cheap. It's about $10, but it's
well worth it.
Well worth it. It's written for the layperson.
Yeah.
Okay, the first thing we're going to try is chin tucks. Now, we're going to look for, with all the exercises, we've got about 6 of them we're going to do. We're going to go through each one, and you're going to know which one centralizes the pain.
Which one starts taking the pain out of the arm and bringing it more up into the neck.
Right.
So
like this one, Bob, I think you have the same experience with patients as I will do the chin tuck, and oftentimes they'll say, oh, it hurts back up in here. And then I'll say, well, let's do it some more. And then I want you to not pay attention up there, but what's going on down here in the arm. And after they do 3 or 4 of them, I say, well, yeah, my fingers are starting to feel better, but it hurts more up here. Well, that's a good sign.
that's a good sign.
Right.
Or maybe nothing's going to happen.
Right.
Quite often, for me, nothing happens on the chin tuck.
And then we're going to go to, you're going to do a slight chin tuck, and then we're going to try to extend the neck. But we really find it's best to do with a towel roll, and you support the neck with a towel roll.
Generally to start.
Yeah.
And a lot of times you want to have a chair that, kind of a higher back chair like here, so you can kind of lean back on the chair itself too. You're not really doing like this. You're leaning back in the chair and going back.
Yeah. And
That
if
makes a
you
big
go
difference.
back like this, it's uncomfortable. If you do put a thicker towel roll there, you'll find oftentimes it's more comfortable. And then again, see if the arm is starting to improve, that centralization. Now, you're not going to do 20 or 30 of these, 20 or 30. You're just going to do a few of them, and after about 3 or 4, it should start to show some signs of centralization. If it does start to feel better in the arm, usually we go up to 10 on the first time. Not more than that, and then come back to it later.
And then you're going to be doing these quite often, actually.
Right.
I mean, we recommend at least 5 to 6 times a day, but you can do it every hour if you want.
Sure.
So.
Okay, now if you do both of these and this, and things aren't working out well, it's painful, there's nothing going on in the arm, don't worry, we've got more options. And this is exactly how we approach it.
Lots of tricks to try it.
You bet. So the next one, I did want to mention this little trick. And this is a thing about being a therapist. You learn little tricks that sometimes work. You can lay down, Bob, I'm going to have to.
Yep.
Lay down, preferably on a carpeted floor that's a little bit firm. And you can try your chin tuck laying down, and sometimes just the
Taking the weight off the
Yep.
neck it helps a lot.
Right.
So if it just didn't get better sitting, you can go to try laying down instead and doing it that way.
And it's a little easier. Now you can take a towel roll and put it behind, under your head, and it gives you a little more room for the chin tuck. Be gentle with it. Be patient with it. If it doesn't start to work after a few repetitions, go to the next one, which...
Sure. Now we're doing a little traction, Brad?
Yep, little traction. And you can do self-traction. Take a towel. This towel's going to work
I was
better.
going to say, you probably want a longer towel,
Yep.
don't you?
Yep.
Now,
This,
you're going to grab the towel with the arm that feels better.
right.
Yeah,
Yep.
if you can. Or have someone help you.
Right. I've done this to a patient, and then I say, you got a family member at home that can help, and sometimes they say yeah, and sometimes they say, I got a family member, but they're not going to help. You got to watch out so we don't have any family arguments over
That's right.
treatment. So I like to spin it up like you do one of those, oh, sorry, Bob,
Yeah.
snaps. And then we're going to go like this, and this, again, back into the chair, good posture, bring your head up in good posture, and you're going to go up, and you're going to be pulling up towards the ceiling. Bob, can you
Probably
show?
a little bit of an angle, right?
Yep. It hooks really well against, I hope you can hear me, against the back of your
So you
neck
go
or
on
the occiput.
this direction here. Now, again, you might grab with one arm, Brad.
Yep.
If you have a painful arm.
If this one's the painful one, I'll
Yeah.
grab here.
Right. Now, it would be nice if you had someone here that would give you a little pull.
Right.
And
Now,
So-
if traction works, you're going to feel relief right away. As soon as you start putting pressure on, the pain is going to drop down. It's going to say, oh, that feels good. And then, hopefully, after that, you can start to do the chin tucks.
yeah, the idea is
And
that eventually
extension.
you're still going to get back to that extension.
Right.
Because that's where the magic happens generally is the farther you go back, the more the pain tends to go down.
Right. More
And-
centralization.
Right. Now, you might be one of those cases where that doesn't work at all. I'm one of those cases where actually you try side bending toward the pain.
Right.
What you do first is you do a chin tuck. Do you want to show?
Yep.
Chin tuck, and then you side bend towards the pain, and you repeat that. Chin tuck, side bend towards the pain. Now, if that starts to relieve the pain, I had a dentist that this worked beautifully for
Sure.
him. We tried the extension, just didn't work. He would do this, and it would just take the pain, and eventually took the pain all the way out of the arm and out of the shoulder.
Sure. Yep.
And he's back torturing people again.
So once again, he doesn't use the Novocaine.
No, he's not
Just get in there.
old-fashioned style. So.
So once again, you got radiculopathy in the neck. No worries. Take the system. Work with it. Be patient. Get the Mckenzie book. It's another great tool to use at home. Yep, you can gift it. After your neck pain's gone, you can gift it at Christmas to your
Yeah.
sister, your brother, whatever.
It's a wonderful thing. It's a wonderful life. Thanks for watching.